Hi, and welcome to Cat Chat. Today we'll be talking with Dr. Laurel Leach from Beverly Oaks Animal Hospital about why we really don't need to be afraid of that big, scary sounding disease FIV, and we'll be doing a little bit of myth busting on the disease. It breaks my heart that around the world people have been euthanizing otherwise healthy cats simply because they've been diagnosed with FIV. Being a newer cat disease, I've heard that there are even some veterinarians who aren't well educated on FIV who have made the euthanasia recommendation. I mean, that's like killing someone who's healthy now just because they might die in 20 years. It's absurd. But first, let's talk about the basics. What is FIV? FIV is feline immunodeficiency virus, which is a cat-only disease that's kind of similar to human HIV. FIV hasn't progressed to the cat equivalent of AIDS as often as HIV has in humans, though. Cats who appear healthy could be infected with FIV. The FIV test is quick and easy, and results take just a few minutes. While doing research for this episode, I interviewed Dr. Leach, who has been practicing veterinary medicine for over 20 years. She explains the importance of getting your cat tested.
We want every cat owner to know if their cat has FIV or not. And it's important not because it will cause the pet to have a bad quality of life or die early. It's important to know because you're going to want to take some health management strategies and maintenance strategies with that cat if the cat is FIV positive.
By the way, there is a vaccine for FIV, but Dr. Leach does not recommend getting it, as cats who have been vaccinated will test positive for FIV for the rest of their lives, which can lead to problems. FIV is most common in outdoor, unneutered male cats, as it's generally spread through deep, penetrating bite wounds. Contrary to common belief, it is not easily spread. Cats cannot catch it by simply sharing litter boxes, food and water, or by snuggling and playing, unless, of course, the playing becomes violent. According to bestfriends.org, it's actually very unlikely for a neutered indoor cat to spread it to other cats if the cats have been properly introduced. Oh, and in case you're wondering, FIV is a cat-only disease and cannot be spread to humans. So, what if your cat has been diagnosed with FIV? I know it sounds super scary, but as Dr. Leach points out,
generally cats with FIV have a good longevity, and I think most owners can expect their cat to have a fairly normal longevity. There are some cases where the cat gets sick and needs antibiotics, and that's important for owners to know that if their cat does get sick, the cat does have FIV, so they do have to take the cat in for treatment sooner than the common, well, let's wait and see how the kitty does. But generally these cats have a good longevity and a good quality of life.
FIV is a slow virus, and many FIV cats live long, healthy, relatively normal lives. Keeping them indoors in a stress-free environment and feeding them a high-quality diet will help to keep them healthy. Also, it's best to bring them in for a checkup twice a year and keep a watchful eye out for early signs of illness. You want to make sure you quickly nip anything that develops in the bud before it progresses too far. Other than that, give them lots of love. This week, I'm going to be introducing some FIV kitties who are looking for forever homes. If you're interested in adopting a new cat but are worried about FIV, take some advice from Dr. Leach.
A lot of people are afraid to adopt an FIV positive cat because they're afraid of what they might be getting into with medical costs and illness, and they just are afraid that the cat may not do well, and that's not so much of a concern. But if you've got an FIV positive cat, you're the perfect home for another FIV positive cat, and if you could help those cats out and adopt them, that'd be great.
Be sure to check out the Kitties of the Week. That's it for today. See you next time on Cat Chat.